This is part 4 of the pediatric examination lecture for Clinical 2, and we are beginning with the newborn screening test. Now, the newborn screening test is performed on an infant to screen for the presence of different metabolic and endocrine diseases. And one of those big ones that we talk about is the PKU, the fetal ketone urea. Okay, there are several different tests that are listed here that we look for, but that's the biggest one most of the time that you're going to hear about. Sickle cell anemia. You're also going to see some of these other ones, different types of congenital diseases, but specifically with PKU, this is a congenital hereditary disease that causes a lack of that enzyme phenylalanine hydroxylase, and typically we've got to have that, especially for that tyrosine, which is needed for the normal metabolic functioning. So what do we do if a patient doesn't have it? Then what can happen if it's left untreated? Now, we can treat it, but if it's left untreated, we can have mental retardation, tremors, and poor muscle coordination. And this is their biggest time of development, so we definitely don't want to get in the way of that. When we have the early detection and treatment to prevent the adverse reactions with PKU, the infant's placed on a special low phenylalanine diet, and they're monitored periodically to see if they're actually building up the PKU. And what we want to do is we want to make sure that all this is taken care of before that child reaches 3 to 4 weeks of age. So obviously this is one of the first things that we will do when they come in, and typically we can do just that heel stick, and we'll get to that in a second. But PKU is an uncommon condition. It typically affects 1 out of every 12,000 births. But if we detect it early, that's a good sign, and we want to make sure that they have a better prognosis. So we definitely want to give them what they need. So for your formula-fed infants, they can be tested earlier, but your breastfed babies, that colostrum, it doesn't have that phenylalanine, so we usually don't do that when it says here. Even the test results of breastfed infants, it's usually invalid until that mother starts to produce their regular milk versus the colostrum. Now, all the states in the United States require the newborn screening, and the best time to do that is between days 1 and 7. So remember, we're actually going to see that pediatric patient in the office for their very first visit right after birth on days 3 to 5. So that's going to be the days that are the time when we actually do that PKU. All right, this is actually done or performed on the lateral or medial posterior curve of that plantar surface of the baby's heel. We don't want to do it directly in the center, because we definitely don't want to hit that calcaneus and cause any osteomyelitis. So if you've been in the lab class, you've heard a good bit about that. We don't want to cause any osteomyelitis. So some of the big things that we have to remember when we are doing this newborn screening test for the PKU is on your procedure in your textbook is to wipe away that first drop of blood with a gauze pad, and then when we start to fill up those little circles that are on the card, we want to completely fill this first circle with that blood specimen and make sure it gets good and full. And then one of the biggest things we have to remember to do is to mail that in within 48 hours to the testing facility. So if not, then we're going to have some problems and have invalid test results. Then as far as if the child does test positive, then there's going to be some further testings. You're probably going to take whole blood to see what else needs to be done, and look at other levels within that patient's blood. This ends the pediatric lecture for Clinical 2.